when you examine. You'd also see you will also see, as I said, the tests to order. So the first test to order, and if there are any other tests, they'll be listed here as well. And you can do that with more than one, obviously, condition. And if you wanted to, then you can go into the full condition from here. Okay, so obviously this is just an example. It could have been, you could be looking at any of the other assessment topics, assessment of back pain, assessment of acute abdomen, and any of the other well over 100 other assessment topics. Okay, if there are any guidelines, they'll be here. Looking at the resources section, you'll see all the references in one place. At the end, you'll also list all of the images for you in one place as well, just to help you. So you can look at these images can actually be used for your own, for teaching, for example, as long as you reference them. And you can open them either by just clicking on the image, or if you wish to, you can select one or two images and click on the open image at the bottom. I'll send you in a moment a link, inshallah. So I'll send you, actually, I'll do it now since I'm getting a few questions. So I'm splitting this into two sections. So if you've already got an account with BMJ, if you click on the link that I've just sent, you can create an account from that link just to make things sort of easier for you. Once you've done that, you can just sign out and then use the second link I've provided, or I'll be providing, to sign in. So if you can use the first link to create an account and then the second link to sign in. But I'll try and go through that again towards the end. So this is just an example of an assessment topic. We can now have a look at the condition topic. So if I click on Show Conditions, that's another way of finding your information, as we spoke about searching. The other way is to click on Show Conditions and then navigate to the particular condition. Excuse me. And navigate to the particular condition. These are listed alphabetically. And you can also navigate to them using these specialties on the left-hand side. For example, if I click on oncology, I'll see all of the related oncology topics, for example, cervical cancer. That's another way of finding your topics. I wanted to highlight another way as well, which is the if you start typing, then there'll be an auto-suggest list appearing, and then you can just select the relevant topic, or the topic that you're looking for. If you click on type 2 diabetes for adults, you'll be taken to the particular topic. So this is an example of a condition topic. You'll see on the main page the most important sections. So the history and exam, diagnostic tests, and the treatment details. These are just the highlights, but they're the most important highlights within the topic. There's also a summary on the highlights tab. On the basics section is another section that's used a lot at universities, of course, because students are learning about these particular conditions. So on the basics tab generally has a definition, the epidemiology, etiology, pathophysiology, and a lot of the time you'll also see the classification by the various societies. There is also a prevention tab here. Excuse me. There's also a prevention tab here. This has in this particular case, primary and secondary preventions and screening. I'd like to take you to the Diagnosis tab now and just show you what's on there, as this is one of the most used sections, as I said, the Diagnosis section and the Treatment section. So on the Diagnosis tab, you'll see the key diagnostic factors and then other factors. Again, you'll see how the information is laid out in links that are extendable. And you can, of course, reveal all the information in one go if you wish to. And on the right-hand side, you'll see the risk factors. So strong and weak. In this case, we've only got strong risk factors. Again, these are links that can be expanded to reveal more information. The tests, the tests are ordered by first tests to order and then other tests to consider, as you see here. If there are any emerging tests, they'll also be listed here at the bottom. Fasting blood glucose test, so there's an example here. So these are the tests. There is a differential diagnosis section also in the conditions sections to help differentiate between conditions of similar symptoms. So you have the differentiating signs and symptoms and the differentiating tests you can run to differentiate between these symptoms, okay? And you have the links also to these particular conditions, okay? Again, we do provide a step-by-step approach to diagnoses for if you want to learn about a particular condition and so on. So there is a step-by-step approach. So if you'd like to think of it as a step-by-step approach, it's like the textbook approach for learning. And then these other sections are things that you can use to get to the information quickly, or at the point of care use. So there is a criteria section there. Guidelines are here. Various guidelines, of course, Europe, international, North America, and so on. Case history, also another thing that's good to use for teaching. So generally we have typical and atypical presentations of the case, of the condition, sorry. Going into the treatment section, so we have the treatment are grouped by patient group. So we do actually have also, if it applies, there'll be presumptive treatment as well. So if we look at this first step, we've got presumptive treatment. The first line treatment, obviously it says here non-pregnant at initial diagnosis. So the first line treatment, blood pressure control. You will see sometimes that we've got evidence scores. So if there is a statement here about the particular treatment, and then the evidence score. We're saying the evidence behind this is a evidence score A, or level A. To get to the drugs, you can click on the the dosage will be clear, available to you here at this stage, but you can click on the drug name to navigate to the drug database, to Martindale, for comprehensive information about any particular drug. Okay, if I just do that, the plus means that all the people within this particular patient group should also be prescribed this, if you like, drug or treatment, I should say. And adjunct means only certain people within the particular patient group. So this is the treatment section. As I said, it's in patient groups. Of course, in treatments, there is also a step-by-step approach. If there are any emergent treatments, they'll be listed here as well. In this particular case, there are some emergent treatments, and they are listed here. Guidelines will be here, and then the evidence section. So we saw one way of getting to the evidence, and that's from within the links in the treatment details. The other way of getting to the evidence is by clicking the evidence link. And here is the evidence that's been incorporated from BMJ clinical evidence, all the related systematic review questions, and their grade tables there are also links to the grade tables to get to them directly from here. If I just scroll down a little bit, this is evidence that's been brought from elsewhere, not from BMJ clinical evidence, and these are the evidence scores that we've given these particular evidence from outside of BMJ. For example, there is an evidence score A from this particular study that's been published on the, not sure where it's been published, but it's a systematic review, actually. Okay. So, as I said, these are the related systematic review questions. If I click on one of them, I'll just show you an intervention table. So if I click on the one relating to the effect of blood glucose lowering medications in adults with type 2 diabetes, this will show me the intervention table. So this is actually a very useful table. So it's really summarizing a lot of research, lots of many randomized controlled trials into a very nice table for you. So here we've got the likelihood of benefit for these different interventions relating to this particular question. So we start at beneficial and going all the way down to unlikely to be beneficial. Of course, you can go in deeper and deeper, which is the theme really on BMJ Best Practice. You'll see, as one of my colleagues says, it's a bit like an onion. You can always go in deeper and deeper depending on the need you have and the time. So that's the evidence. Whilst we're here, I just want to mention a couple of things. Some of these personalization features available to you. So I mentioned earlier that if you sign into your account, you'll have access, you'll be able to download the app and sign into it. But also you'll have several tools and features that you can use. One of them, a very important one, one that many people like, is the ability to create a PDF of the whole topic. So by the click of a button, if I click on PDF here, it'll actually download the whole topic for me in a PDF. I understand that many students find this useful to carry the topic with them. Of course, it's available in the app offline, but this also looks very nice, and you can print it if you wish, or just save it on your anywhere. So this is the whole topic in PDF format that can be printed, and of course it's it includes the images and everything on the site. It comes up to over 65 pages. So that's just one of the features that you can use. So being able to print the whole document, or not necessarily print, but produce a PDF of the whole document. Also the ability to add items to your portfolio. So BMJ Portfolio is a free online tool that can be used to manage your learning. You can use that to record your online learning for all the resources, not necessarily resources from BMJ, but you can do that from here. You can bookmark things on any page. You can add notes. Also another feature that's very good for, students like this a lot, being the ability to add their personal notes to the tool. So the university can actually also add notes to pass on messages to the users. So you can add notes from here, just annotate any page, and your notes will appear at the top of the page. And also from here, sorry, the Facebook, I didn't press it intentionally, but yes, you are able to share using social media from here, and the ability to print, share the link with a colleague, email the page to a colleague, and so on. So several personalization features available from here. If I move on to the next section, which is the follow-up section, so we have recommendations, complications, and prognosis. I'll just show the complications. I like the way the complications are laid out. So the complications are laid out like as you can see here, based on the time frame and the likelihood of the complication occurring. And again, they are expandable. So if I click on blindness, for example, you see a little summary here. And what this is saying is, for patients and adults with type 2 diabetes. They have a low chance of getting blindness in long term. And then you see a little summary here saying it happens in less than 5% of people, at least one eye, and it tells you why it happens, caused by poor blood pressure and glucose control and so on. So this is just enough information at this stage. If you wanted to see the comprehensive information, then there is a link there to go on to that particular topic. Then there are the resources. We've already mentioned a few things here in the resources section. We've mentioned the references, the images. If there are any further resources that are outside of BMJ that we can advise people to go and read up on, etc., then we'll list them here. We've listed a few here. The further, for example, the American Diabetes Association is an example of the further online resources. Patient leaflets, as I said earlier, they are in English, but the tool does accept Arabic ones. We always list the contributors, all of them, and any competing interests that they list them. They all have their disclosures. And then the update history. Let's just have a quick look at that. So what's happened here recently? So it was updated in June with some new references were added. And again, it was updated actually today, 11th of November. It's updated today. There were some new drugs added, major treatment changes, and new references as well. And then related content is another nice section. You do have access to the journal, so this is very relevant for you. So you can view similar topics on BMJ Best Practice. We do have something called BMJ Learning. You don't currently have a subscription to it through SDL, but you can also look at the journals. So recent journals relating to a particular topic. So, for example, a research article from the BMJ published last week that has relevance with this particular topic here, and then from the other journals that we publish, an article published yesterday on evidence-based medicine relating to this particular topic as well. So this is very nice if you want to read up further on a particular topic. However, if you don't have the time there and then you can make use of BMJ portfolio. So you just select the items that are of interest to you, and then you scroll back to the top and check the items to your portfolio, so that you can look at those items at a later stage. I mentioned a number of personalization features earlier. To manage all of them, you can do that from this button here, My BMJ Best Practice. And then here you have all your saved searches, your bookmarks, and so on. So I've got a couple of saved searches, one of them in Arabic there. My BMJ portfolio entries. If there are any local guidelines or local patient leaflets, they'll show up here. And then the notes at the end there. So these are institutional notes. These are just really examples. They don't apply to you. Most of you, I guess, would not have any institutional notes. But personal notes, so these are my personal notes. I can manage them from here, edit them, navigate to the sections where they've been added, and so on. I just wanted to mention a couple of other things before I go into how to log in again. So if I look at if you click on resources on the top right corner, I just wanted to mention that you can view the drugs that have been referenced within best practice from here. And for those of you who are interested in the evidence topics from BMJ Clinical Evidence, then you can click on BMJ Clinical Evidence on the top right corner, and this will take you to the evidence topics on BMJ Best Practice. Do we have any questions about BMJ Best Practice at all? How to get to it, how to use it, and so on? Okay, so what I'd like to just do quickly is I'll send you those links again with the steps. So obviously these steps are only for, so these steps are only to be used during today's session. So if you are accessing through SDL or through university, I'll show you how to do that. But if you follow the steps that I've just sent, you'll be able to create your own account today and download the app and log into the app, and you have offline access to this tool as well. If I can just log out, and I'll show you what will happen when you access from university network or using the SDL portal. So when you get to the site, just bear with me a moment. I think there may have been an issue with the, yes, there is an issue with the link I've sent. I do apologize. So the second link, I'll resend again. Apologies. So that's the second link. It should work now. Okay. So when you reach the Saudi Digital Library, when you use BMJ Best Practice, either from the Saudi Digital Library portal or from university, you'll see on the top right corner the access has been provided by Saudi Digital Library or your university. What you do then is you click on sign in and then register. So the sign in and then click on register at the very top, and this will take you through a very quick registration process. At the end of this, you'll be able to access, to have your own personal account and as I said, create, download your app and access it as well. But for now, if you can follow the steps I've sent, and you will be able to, as I said, you'll be able to create your own account from there. So, do we have any questions at all? Okay. So, okay, I'd like to thank everyone for taking the time today to attend this session. If you do have any queries after this session, then please feel free to get in touch with me using the email address on the screen. And I'll also, if you have any questions also, then you can also use your microphone if you wish to ask as well. Also, if you have any difficulties registering using the links I've provided, then I'll be very happy to help with that as well. Okay, and if I just scroll down a bit. Okay, excellent. So, thank you very much for your time, as I said. I hope you've benefited from the session. Also, I do apologize. I think there may have been an issue with the system. The session is meant to end at 9 o'clock. Sorry, but for some reason I noticed the email today mentioned 9:30. But we went through the items that we wanted to cover. But if you do have any queries, any questions about how to use the site and so on, then please let me know. I don't actually mind if you want to. I'll send you a couple of videos that will help you with the. Actually, we can do that now. If I send a video, if anyone missed anything about the BMJ Best Practice, I'll send a quick video that will summarize most of what we've said. So I've just sent a link there, and the first thing you'll see, or the first link on that page, is it says take a tour, and it's basically a YouTube video which will show you how to, it just summarizes what best practice is for and how it's used. If you have any queries about how, as I said, about the journals, how to access them, which journals you have access to, anything like that, I'll be very happy to help with that as well. And as I said, my email address is on the screen, so feel free to send your emails, comments, feedback, and I'll be very happy to help with that. Okay. Okay. Thank you very much for your time, everyone. So we'll end this session now, inshallah. Thank you. Assalamu alaikum. Have a good night.